Good afternoon, everyone. My name's Sara Ahern. I am one of the research programme managers based at in Bradford and currently managing the BiBBS Achieve research study, which is what I want to talk to you about this afternoon. I'm actually presenting on behalf of our amazing programme coordinator, Kirsty Crosley, who unfortunately can't be here this afternoon. So I'm going to do my best to do a good job in her place. Okay. So just a really brief bit of background as to why we see it as so important that we incorporate measures around digital technology into the BiBBS Achieve study. We know that screens are increasingly embedded within children's everyday lives and from a very early stage. And this can include everything from TV viewing and computer games, but has increasingly shifted in recent years to things like tablets, which are often marketed for very young children, and smartphones, which children see caregivers using and are introduced earlier and earlier into children's lives. And plus there's also an increasing shift to screen use in schools as part of children's education. We also know that excessive screen time can negatively impact on children's development in terms of their cognitive and language development, but also their social and emotional development. And while there are benefits to screen times for children, it's not all bad. Especially where there is co-use and co-viewing with caregivers, there are clear risks. So the evidence tells us that too much is linked to poor executive functioning, poor academic achievement. It has the potential to reduce that caregiver-child interaction in those early years, which impacts on language development. And that's especially true where that co-viewing or content quality is limited, but also that overuse is associated with some physical and emotional health problems in children. So specifically thinking about things like obesity and poor mental health. When we think in particular about use in middle childhood, what we're likely to see is a shift in patterns of use. So really moving away from that shared or co-viewing with caregivers towards more independent use. And that means more autonomy over the time spent on screens, but also what's viewed and how it's used. There's a shift away from sort of usual television content to more online viewing and online content, and at a rapidly increasing rate, a move towards more socially interactive content. So whether that's things like online gaming or social media. So back in March, the government launched some new screen time guidance for parents and caregivers of under fives. But there's been this gap for the sort of older age group. But in the past fortnight, they've also announced plans for new screen use guidance for parents and caregivers of children aged 5 to 16. And there's a call for evidence out at the moment. But what we know is that there is limited longitudinal evidence exploring these early patterns of use and their implications in this age group. So what is BiBBS Achieve? I'm going to start by just outlining what BiBBS is, which is Born in Bradford's Better Start. So this is a birth cohort that was established back in 2016 when we began recruiting pregnant women and their babies from across 3 inner city wards of Bradford. The cohort was initially established as to support evaluation of the Better Start Bradford programme. So that was part of a 10-year National Lottery funded a Better Start programme, aiming to provide pregnant women and families with very young children with projects and services aiming to improve their social and emotional development, their language and communication development, and their health and nutrition. So the programme actually ended in early 2025. And our recruitment of BiBBS finished in the summer of 2024. In that time, we recruited over 5,500 pregnancies into the cohort, and those were to just over 5,500 mums. And so we've got a total of just over 5,300 children in the cohort. We are unique in terms of the level of diversity and social disadvantage within our cohort. So we have this really valuable, under-researched and high priority population. But we are also the only UK birth cohort who we're recruiting throughout what we're terming systemic shocks. So thinking about things like austerity. We had the COVID-19 pandemic right in the middle of our recruitment and the cost of living crisis. So this gives us this amazing position to start thinking about how those things have impacted on children's development. But also because it was set up as an interventional birth cohort, so that platform for evaluation of services, we are also able, hopefully, to understand more about how engagement with those early years services might mitigate impact of those systemic shocks. So bringing us to BiBBS Achieve, for our BiBBS families, when they were first consented into cohort, they completed a baseline questionnaire and provided lots of information about lifestyle, demographics, but also biological samples. And they agreed to linkage of routine data. So thinking about things like maternity records, health visiting, GP, dental, hospital records, and also subsequently children's education records. What we want to do through BiBBS Achieve is to enhance this cohort through additional data collection in middle childhood, so specifically when children are 7 to 8 years old, and we're going to open this up to children who are not currently enrolled in BiBBS. We're going to do this by working collaboratively with around 19 inner city primary schools in those 3 target wards, and to collect data from all year 3 children over 7 years. So we're aiming to recruit ultimately around 8,000 children. We're also going to be collecting new data from our BiBBS mums, so any mum that has a child turning 7 to 8 in that time frame, and we'll be doing some longitudinal qualitative data collection with families as well, and I'll talk about all those things in a bit more detail in a second. We're just coming to the end of our pilot year in schools, and we've been incredibly successful so far. We've piloted measures in 8 schools and have recruited over 3/4 of our target schools so far for next year. We've actually engaged all of them, so we're really hopeful that by the summer holidays we'll have every single one of them recruited. But the only reason we've been so successful in this is because of the involvement that we've had from schools, wider stakeholders in the community in shaping the research. And that is to ensure that it feels relevant, that it's feasible and acceptable, but it's also helping to address those issues that schools and families are telling us that they're experiencing. And I think what's been really interesting over the last few months is these concerns around screen time have been expressed by head teachers, teachers and parents. And for that reason, we've been really keen to incorporate the topic into both our quantitative and our qualitative research. So just in terms of child measures and what we're collecting in schools, we're collecting physical health measures. So that includes things like height, weight, bioimpedance and blood pressure. We've got a reading and language assessment, a self-report wellbeing questionnaire that the children will complete, which includes questions around screen access, ownership and usage. And we're also collecting a teacher-completed strengths and difficulties questionnaire for all participating children. From our BiBBS mums, and we're expecting around 2,500 of these will have children turning 7 to 8 over the 7 years of the project. We're collecting a self-report survey from all BiBBS mums with a child turning 7 to 8. And this will be done either as a home visit or as over the phone with one of our community research team. And we're just finalising plans at the moment for how we're going to incorporate the sort of screen use into this. We're really keen to strike that balance between collecting the right things and things that we're interested in, but not overburdening mums. But we know that we want to collect things on child screen access and usage, but also things around parental use as well. So with this quantitative data, we want to be able to describe patterns of screen usage within the population. So this ethnically diverse, socially advantaged urban population. We're going to link to routine data for those within the participant pool who are also part of the BiBBS cohort, and complete some prospective analysis that will hopefully tell us more about the impact on children's physical health, their emotional well-being, and also their educational attainment. While we're in schools, we're also going to be doing some cross-sectional qualitative work with children, which will focus on what we're terming hot topics. So these are topics that are identified as particularly interesting or relevant by children, by their families or by schools. And this coming academic year, the focus is going to be on screen use. And that, as I say, has come directly from the conversations with schools and families. We are in the process of finalising the topic guides for this and about to submit ethics, but the plan is to use really child-centred methods that allow children to discuss topics through creative play. So whether that's things like drawing, photo elicitation, using plasticine, but we know that we want to be thinking about not only what children are doing in terms of screen time, but the types of videos and games that they're using, how they observe their parents engaging with screens and phones and etc., and when they see that, their feelings about screens, but also about when they're told it's time to stop using screens, and the sort of emerging familiarity with things like social media and AI. And finally, we have our longitudinal qual work, which we're really excited about, while also being aware that it's very ambitious. So for this, we're planning to recruit 30 of our BiBBS families with children aged between 5 and 8 years. And we will be recruiting whole families, and by that we mean everybody who's living in the household, to take part in annual activities. So that will include sort of individual level interviews as well as more sort of focus group work. And that's to understand experiences at a family level. We know in Bradford we have very diverse families in terms of that family dynamic. We have lots of multi-generational households where there is likely to be sort of other influences going on in terms of parenting and how children are managed within the house. So our first year will be very much focused on developing relationships with families and understanding those family dynamics, but we're really keen to see what comes out of this sort of hot topic research and the initial screen usage data that we collect, to see if there's potential to integrate the topic into those future conversations with families. So the aim through all of this is that our qualitative work will sort of come together with the quantitative data to provide really good level sort of contextual information, and provide an opportunity to explore children's perspectives, which often is missed. So thinking about the sort of pros and cons of screen use, how it impacts on their lives, and as I said, that sort of emerging awareness of things like social media and AI. Given the announcement recently of the new guidance for parents as well, we're thinking about how there might be an opportunity to explore families' perspectives on the guidance, and understand how this might sort of change behaviour or attitudes towards screen use. I think what's really interesting is the speed at which screen use has evolved over the last few years. So, given that this is a 7-year study, we're likely to see further shifts in how screens are used by children at different stages and ages. So we really need to be thinking about being ready to adapt to that as well. So a final note on how we want to create impact through BiBBS Achieve. We've got really close relationships with schools within those 3 wards, but also in the wider district. Really good relationships with the families and communities around research, as well as our sort of wider educational stakeholders and policymakers, which means that, as we're getting this learning, we're in a really strong position to mobilise it quickly and hopefully support evidence-based decision making at a local level, a regional level, and potentially nationally as well. And I guess the other thing that I haven't mentioned is we are collaborating with other birth cohorts internationally to try and make sure where possible we're aligning measures. So there is potential then for us to be thinking about comparing our data, but also, having that stronger evidence to have some more sort of international relevance as well. So I just want to end by thanking all the people that make our research possible. So particularly thinking about our schools, children and families, and our community research advisory group and wider stakeholders who've all been incredibly generous with their time in helping us shape BiBBS Achieve and getting it off the ground. And also obviously to Kirsty, who leads our amazing research team and makes all of it happen. Thank you.